17,027 confirmed aggregate cases of coronavirus in Victoria. That's 282 more than our update yesterday. I'm very saddened to say that the total number of fatalities due to this global pandemic in Victoria is now increased to 334. That is an increase of 25 since yesterday. Our thoughts and best wishes, our prayers and support go out to all of those families. This will be an incredibly difficult time and our thoughts are with them. By way of breakdown, one male in their 60s, 4 females and 3 males in their 70s, 6 females and 4 males in their 80s, 4 females and 3 males in their 90s. 22 of those 25 fatalities are linked to aged care outbreaks. There are 657 Victorians in hospital. 44 of those are receiving intensive care and 32 of those 44 are on a ventilator. A total of 1,975,030 test results have been received, which is an increase of 15,728 since yesterday. There are 3,626 cases with an unknown source, an increase of 148 since yesterday's report. There are some 1,064 healthcare workers who are active cases and 7,474 active cases in total across the state. I am pleased to be able to say that regional case numbers are coming down. We have some 436 that are in those regional local government areas that are covered by stage 3 restrictions. There are still some that are being investigated just to determine the exact, not so much the address, but where that person was, where that person would normally be expected to be found. But again, I just send a message to Geelong, Bendigo, Ballarat residents and indeed to all regional Victorians, but especially in those 3 big regional cities. Please come forward and get tested. It's a really important way in which you can contribute to our collective fight against this enemy. If you come forward and get tested and then wait for your test results at home, then given we have so little flu in Victoria today, because of physical distancing and all the other measures that we're taking, if you've got symptoms, even very mild symptoms, there's every chance that you've got this. So at the earliest moment, so as soon as you develop symptoms, no matter how mild, if you can come forward and get tested, wait at home till you get your test result. Those test results are being processed as quickly as they possibly can. I had Kath relayed a story to me this morning of a friend of hers. She's a nurse. She was not feeling 100% yesterday. She went and got tested at around lunch, fairly early in the morning, about 9ish, and then had received her results first thing this morning. She's negative. So there are every effort's being made to turn around those test results as quickly as possible. That particular test result was within 24 hours. So if you've got any symptoms at all, please come forward and get tested. That's important any day, but I think it becomes even more important in those regional cities, and it's certainly when you take into account that if you've got symptoms and we've got flu at such a low level, then as the Chief Health Officer has noted, there's every chance that you've got this. And if you have, then getting tested, staying away from other people, that's how we'll drive these numbers down even further. Bendigo, Ballarat, Geelong, please come forward and get tested if you've got any symptoms whatsoever. That message, of course, applies to every single Victorian, regardless of their postcode, but we really are trying to have that testing push in those 3 regional cities. Just by way of cases, Greater Geelong is 155 active cases, Greater Bendigo 47 active cases, Ballarat 28 active cases. I think they are relatively stable from yesterday, and the total number at 436 is down considerably, but there should be no sense of complacency. Coming forward and getting tested is the most important thing to do. I can provide some further update in relation, as I do most days, to aged care as at the 17th of August. Total number of cases associated with aged care facility outbreaks since 1 January is 3,149, of which 2,009 are currently active. Total number of outbreaks, so not individual cases but outbreak settings since 1 January, 148. of which 119 of those 148 outbreaks are currently active. And I probably don't need to provide you any further details than that, but
Do you have the statistics for how many deaths in aged care?
216 is my cumulative total, Rachel, but I might double confirm that for you. That's the number, but I'm not sure whether that's been updated appropriately. I can confirm that I won't be able to provide you with the number of shifts worked today, but I will be able to give you an update tomorrow that will take account of activities over the course of the weekend and today. But it's certainly a number that's going up as more and more teams of nurses from hospitals are sent into private aged care facilities to support residents and to support that sector. As we've been asked to do, it's the appropriate thing to do, and I'm very, very grateful to those hospital nurses for the outstanding job they're doing. In disability facility settings, as at the 15th, 87 total active cases. That's an increase of 6 since yesterday. They're all NDIS provider services. I'm more than happy to take any questions you have on that, or to provide a more, if you like, a kind of rolling update. I've done this a few times now, but we've got numbers that they're relatively stable, but it's a sector that's of concern to us, and it's a sector that's of concern to family and friends, and of course clients and residents. If there's more that we can add in terms of updates each day or every few days, then of course we're more than happy to do that. Our rapid response to those disability settings is well and truly stood up and is working well, and we continue to work with the Commonwealth to try and make sure we've got the very best response in place in that sector. It's really important that we look after the most vulnerable, and that's exactly what's happening here right across what is essentially not necessarily funded or run by our government, but we're all in this together, and we've all got to work as a team and make sure that we've got the best response in place. Now, I think that's probably all from me in relation to updates. Of course, we're happy to take any questions, but before we do that, I should say, Minister Williams has joined us today. We know, I certainly hope there's a recognition in the Victorian community that taking action against family violence to try and reduce the incidence of family violence, to keep women and children safe across our state, that has been a key priority for our government since before we were elected, way back in 2014. We've not wasted a moment trying to build a better system, trying to bring this issue out into the open as much as we can. So better service response, changing attitudes, because by changing attitudes toward women, we improve outcomes for women, and that investment comes in many different forms, and at times of crisis, arguably it's never more important. But to speak to some extra funding that's been appropriately allocated to different parts of our family violence response based on what's occurring in that sector, I'll now ask Gab to make a few comments, and then we're happy to take any questions you have.
Thank you, Premier. Thank you all for being here as well. Thank you, Premier, for that introduction, which neatly sums up the fact that family violence response and our investment in family violence has been a hallmark of this government so far, but we also appreciate that in times of crisis, in times of disaster, the risks that are posed to many in our community are heightened. We have been, of course, reminding Victorians to stay at home at the moment to stop the spread of the coronavirus, but we also know that for many, home is not a safe place to be, as sad a reality as that is. And I know that the pandemic presents really unique challenges for those experiencing family violence, but also for those services that are supporting those people who are experiencing family violence. And we've said throughout this event that we remain committed to ensuring that people experiencing family violence are kept as safe as possible, which is why today we are announcing a further allocation of $20.41 million to support critical and immediate services that are targeting the perpetrators of family violence, those who use violence in the home in order to keep victim survivors safe. Now, this investment will essentially get more perpetrators of family violence into alternative accommodation, which, it should be highlighted, supports victim survivors of family violence to be able to remain safely in their own homes. We know that this is particularly important for those with children, where the disruption to daily life at the moment is already pretty significant with homeschooling and the like, or remote learning, and so that stability of being able to stay in your own home can be absolutely critical for many, many families. So paving the way for perpetrators to be moved out of the home is a really significant and helpful development to those experiencing family violence in situations where that can be done. It also means that perpetrators are held accountable and are also, and really importantly, kept in view of the system. And we can't underestimate the significance of having people who use violence in view of the system and actively engaged in the system, because that's one way that we can, of course, manage risk, but we can also ensure that those people are getting the services that they need to ultimately improve their behaviour and keep their families safe. We also know, and I've touched on this, that the coronavirus pandemic has created some challenges for the delivery of many of our services, our family violence services, across the breadth of those services, noting, of course, that there is a lot of different components to them. And this is why we're also increasing the support for services as they adjust their service delivery models to this remote environment, this physical distancing environment, and while also expanding the reach of many of those services as well, which we know is critically important at this time. It's also worth noting that within this funding package is funding to expand support services for young people who are using violence in the home as well. To give some sort of context as to why our focus today is on services and accommodation options for perpetrators of violence, I said a couple of months ago when I was standing here that we would be keeping in contact with the family violence service system almost daily to get a sense of what they were seeing, of where the demand was appearing. And one of the demand spikes that we've seen has been in the men's referral service. We've seen an 11% spike in calls to that referral service over the last 4 weeks compared to this time last year, which has demonstrated to us that there is a real demand there that needs to be met, and meeting that will ultimately protect the victim survivors of family violence, those families that are most at risk by those perpetrators not getting the support that they need. I also wanted to highlight in this, and it's a message that we've been taking every opportunity to convey, and it is a critically important message, which is that if you are experiencing family violence, if you are unsafe in your home, it is perfectly legitimate to leave. You will not be fined, and it's also really important to appreciate that services are still there to assist you. The service system is still operating, albeit maybe looking a little bit different at the moment. Finally, I just wanted to touch on too, in relation to that funding package, to put a bit of a human face to it, a human context to it, just how each component, and it's got a number of components, and we can provide you the full details of that after this press conference. But the short-term accommodation and behaviour change programs that are accounted for within this allocation of funding will reach about 1,500 people. The longer-term accommodation options that are accounted for within this package will impact about 100 people, and there will be around about 470 young people who are using violence in the home, or indeed displaying sexually abusive behaviours, that will be able to access programs as a part of this package. Happy to answer any questions on anything in relation to that package, or indeed about the experience of family violence during this pandemic so far.
How are those perpetrators, the 1,500, I guess, identified? Have they been through the courts before? What's the sort of, how are you identifying them?
So essentially what we're seeing through that 11% spike in the men's referral service numbers that we've seen, it's demonstrating that men are reaching out themselves for support. That could be due to any number of reasons as to why during this context men would be taking the opportunity to reach out for that support. a month or so ago, we ran the Respect Women Call It Out campaign ad, which depicted a man in his home demonstrating abusive behaviour. We know on the back of that, anecdotally speaking to the Men's Referral Service, which was advertised in that ad, that men did reach out on the back of that ad, recognising in that ad their own behaviour.
Do you have any statistics at the moment from the police, or an estimate as to how much family violence has gone up over the past couple of months over the lockdown?
I can give you some of the family violence enforcement figures that have come out of Operation Ribbon, if that's helpful for some context. So we know that the most up-to-date figures that we've got, that police have conducted 16,034 compliance checks. That includes 11,291 contacts with victim survivors, so that's police contacts with victim survivors, and 4,742 contacts with perpetrators of violence. That's as of the 9th of August. We know that in those sort of compliance checks or safety checks, that police have detected 4,436 family violence offences, including breaches of intervention orders and assaults. That's resulted in over 558 people being charged and remanded for family violence related or other criminal offences. And there's a further 470 people who have been arrested and will appear in court at a later date.
How does that compare to
I don't have the comparative data to hand. We can get that for you, though. We can give an indication.
Is it a big increase?
Well, in terms of when you're looking at the rates of family violence through this period, it's a complex picture. I'll attempt to explain why that's complex. We effectively measure that through interaction with a range of services. The police is one avenue, but it's not the only avenue. We've also got child protection services, specialist family violence services, and others. So what we've been seeking to do each and every day, and gathering this each week for review, is to have a look at what that cumulative picture tells us about the rate of family violence in our community. That, as I've said, that picture is very complex, more complex than you might expect it to be. For example, when we went into the first phase of lockdown, what we actually saw was a dip in reporting in that first phase. And then it started to correct, and we started to see an upward trajectory in reporting of family violence. Then, if you come to our current period in time, that sort of second phase of a harder lockdown, we saw it dip again. Now, it's not to be unexpected, partly because there are more limited opportunities to reach out for help when you are confined to your home, which is part of what we're attempting to deal with in the previously announced funding package, and this as well, in terms of helping those services navigate a different environment. But we would expect, as things begin to open up, as it did last time, that would start to correct and that trajectory would start to rise again. That seems to have been the pattern in other jurisdictions as well, which just highlights to us that this recovery phase of the coronavirus, as we begin to open up, as life begins to return a little bit, we would expect demand to increase for services during that time.
And is the perception that so many people had early on that family violence would increase because of the pressures, is that perception overall being realised?
I think it's fair to say. Well, I'll respond to that by saying this: there's what the data tells us, and then there's what is invisible in the data, which tells us in some ways just as much. So those dips in reporting probably highlight to us the challenge that we knew people would be facing in reaching out for help in a situation where they're not moving around the community and having all the interactions that they would normally have in a community through schools or friends or the local cafe or whatever part of the community that they might ordinarily be able to reach out for help in. So that dip sort of demonstrates that to us. But what we also know is, from speaking to our service system, that the interactions that they are having at the moment are far more complex. So case managers will be able to relay to us that many of the cases that are coming to them, many of the situations that they're dealing, will have many, many layers of complexity to them, and they're noticing, which of course then means those services are having to spend more time with those people in order to be able to properly respond to their circumstances. So there is a growing complexity of cases in this time, but it's really important to note that just because the numbers of reporting dip, that doesn't mean that family violence isn't taking place. It just means exactly that at that given point in time, people aren't reporting through traditional channels.
So will the resources be there coming out of this dip? Obviously you're expecting things to go up. Will the resources be there? Will there be enough resources to deal with cases that present at the end of this lockdown?
Well, there's sort of two parts to answering that. The funding that we're allocating through this package, this perpetrator focus package today, and also the funding that was formed part of earlier announcements, is designed to get us through, the months ahead. But the second part of that is also in Victoria, we have so far invested some $2.9 billion into addressing the recommendations of the Royal Commission into Family Violence. That $2.9 billion constitutes more than every other jurisdiction in Australia combined, just being invested here in Victoria. So we are already, even before the pandemic, in a process of making sure that our service system meets the needs of those who rely on it. That should hopefully serve us well going to the time ahead. But of course, this is an environment that we are monitoring really closely, and if we begin to see need emerging from those daily discussions that we're having with the service system, we will of course look to address that.
And the money will be going to cover the accommodation. Is that the sort of like
what was
the
that,
money? The 20 million, is that mainly for the accommodation?
No, there's quite a number of components to it. Some of it goes to sort of shorter-term accommodation needs, some of it goes to longer-term accommodation needs, but there's also components that go to access to behaviour change programs, to broadening the reach of adolescent violence programs as well, and adolescent programs that go to sexually abusive behaviours, among other things. So it is there is a series of different components to it, and of course the support for organisations, those service providers, to adapt their service models and to be as responsive as they can be in this unusual and unprecedented environment.
Is this new or all, like money, like extra funding, or?
So what we've done is, in that monitoring of where demand is, we've reallocated a portion of the $20 million that we originally allocated to short-term accommodation options for those fleeing family violence situations, so that they could isolate safely, and we announced that a couple of months ago. So we've reallocated a portion of that, because what we were learning from services and what the demand on that was showing us was that that wasn't quite where the immediate demand was. We always said that we would be responsive as possible and pivot to where the need was. Our discussions so far and the data that's come to us has demonstrated that the perpetrator response was demonstrating a need. So we have reallocated some of that funding to this, but it also includes money from the National Partnerships Agreement with the Commonwealth as well.
Premier, if I could, on aged care. Sure. How many, have you got any data on those people in hospital? How many are aged care, and does that concern you that the death toll is just going to keep rising?
I don't have a breakdown as of today in relation to how many of those 657 Victorians that are in hospital are connected to an aged care setting, but I'm more than happy to try and get that for you. Look, this is a very difficult day for those families, 25 families that will be planning a funeral, and our thoughts and prayers, our best wishes, our hearts go out to them. This is really very, very challenging. I would again make the point though that whilst there are many of those 25 people are much older and they are connected with aged care, this is not just a challenge for older people, it's a challenge for all of us, and we have to do our level best every moment of every day to try and drive these numbers down. In better news though, of course, to have another sub 300 day is good in terms of that trend and that general movement down towards the lower case numbers. But as I said yesterday, we're strong. There's good cause for people to be hopeful about the future, but we just can't allow any sense of complacency to creep in here. This is an ultra marathon, and we just have to keep pushing forward each and every day. And I think Victorians will do that. My sense, a growing number of Victorians are following the rules. I'm proud of them. I'm grateful to them. But we We just have to keep pushing forward each and every day.
Premier, we've now had more than 200 aged care residents die from coronavirus. Previously, you've cited privacy reasons for not naming how many residents have died at each aged care home. I would have thought that there were accountability reasons for making that information public. Is that something you'll consider?
I don't know that I'm sure I may have said that, but I think that is essentially advice from the Chief Health Officer. I'm happy to have a discussion with him, as well as with probably with federal authorities as well, given that it's a shared response, but of course it's a Commonwealth system. I'm more than happy to raise that with people. I don't think it was a kind of one-out decision. I think that's Brett's view, and I think it's well understood that we have to be very careful sometimes where there might just be one person in a particular aged care home that we're not identifying someone. We've all got to be, and I think we're all trying to be as sensitive to families as we possibly can be, because it is a very difficult time, and some won't have any objection to their loved one being identified. Others may have a very different view, but I'm more than happy to follow that up.
Premier, on the disability sector, have you made any progress with the Commonwealth and the Prime Minister in trying to sort of craft a shared response to?
My communications with the Prime Minister yesterday were more focused on communicating with families of aged care residents. He understands, and so do I, that's something we've really got to push harder, all of us, to try and make sure that we're getting the best and most timely information to those families who are experiencing, really significant stress, many of them. It's a very anxious time, but it's also about trying to make sure that anybody who has no cause to be anxious isn't unnecessarily worried. So that was what yesterday was focused on. I think that our rapid response that we've set up is a very good model. We continue to work with the Commonwealth Government about trying to build, if you like, exactly the same governance structure, exactly the same mechanism that we've used for aged care, which I think has been central to bringing some sense of stability to this. It's by no means perfect, and it's by no means over, but the arrangements, that shared effort, all the most senior people around the table at the same time, all working with a common goal, and that is to protect the welfare of aged care residents. I think that's a model that would serve us well in other settings, and I think that the disability sector is one of them.
So if you take that model, sorry Nick, if you take that model to the disability sector, what would be required in terms of resources and boots on the ground?
I don't think it's much more resources. I think it's just a matter of, and that's probably its most appealing feature. No, I think it's about having all the right people around the same table, and everybody owns the problem, and everyone works towards the best possible outcome. So that's what I'm trying to achieve, and we continue to work with the Commonwealth on that.
Are you confident then everybody can work effectively together, given there's been a bit of friction over the past few days, well documented?
Look, whether it's well documented or just documented, I'm not entirely sure. I'll leave that to you to judge and your readers. But as I've said many times, I'm not interested in having any quarrels with anything other than this virus. That's the most important fight that we're in. It's the only fight we're in, frankly. All of us are at our best when we work together, and I think that's been a really, really important feature of the way in which we have dealt with this second wave and continue to deal with this second wave, and indeed the global pandemic in a much broader sense. So I'm very grateful to the Commonwealth Government and its many agencies, grateful to other states and territories, grateful to our team, every single member of it, many of whom are doing work they probably never thought they'd be doing, but they're doing it really well. So we've got a common challenge here. And whilst there is a trend that is positive, today's a very sad day for 25 families, and this is a long way from over, and we've all just got to keep pushing forward every single day.
Premier, we've got reports out of Hamilton House in Albert Park, a disability home, and we're told there that residents who have COVID-19 are freely leaving the facility. There are private guards, but they appear powerless to stop them. So is there? So
this is a supported residential service, an SRS, a private SRS. I can update you that 10 residents were relocated yesterday. There are another 12 who, as I understand it, will be relocated today. ambulance paramedics, authorised officers, security and indeed members of Victoria Police are, I'm told, on site. Transfers of health management, so people who need to be managed and get care from a health point of view, they're underway, and they're going to Fairfield and the Albert Road Clinic, as I understand it. And there's quite a lot of work going on in terms of wraparound services. As I think you appreciate, there's some very, very complex needs amongst those residents, and we're doing our very best to try and make sure that we meet those needs. My latest advice was that the site was, it was the subject of considerable attention, and every effort was being made to try and bring a sense of control to that, and to make sure that people are not only cared for appropriately, but that their care, their behaviour doesn't have a negative impact on public health. That was my latest advice, literally an hour ago.
So you can understand the concerns of
Yeah,
local
sure.
residents
Sure.
in Albert Park, and the importance of having either visible police or something beyond private security.
Sure, I certainly can, and that's why my latest advice, as I said literally an hour or so ago, ambulance paramedics, authorised officers of the Health Department who have powers and functions under the Public Health and Wellbeing Act, some security personnel that I think are an historic arrangement with that private provider, as well as Victoria Police members. I'm not sure how many Victoria Police members, but I'm briefed that they are there, and they're doing their work, which has seen 10 residents relocated yesterday, and my advice is 12 will be relocated today if they haven't already been. And of course, if there's a need to relocate any more, then of course that's exactly what we do.
Premier, just on the transfer last week of responsibility for hotel quarantine from the health portfolio to the Attorney General,
Yep.
was one of the reasons that that was done because it was unclear whether the Department of Health and Human Services had the power to detain people?
No, I wouldn't put it that way. What I'd say is that this program has been reset and is now under the management and function of, under the command and control of Corrections Victoria, so the people who run our jails. They're not part of the Department of Health and Human Services. They are part of the Department of Justice and Community Safety, and it made perfect sense to put these matters beyond any doubt, and to have the best organisational framework sitting behind that reset was to move it all across to the Department of Justice. So that's no more or no less than that.
The ambulance union's calling you to follow WA's lead and introduce presumptive legislation for healthcare workers in regards to COVID-19 and workplace injury or illness. Is that a reasonable idea, given how many healthcare workers have fallen ill?
Sure. I haven't seen that detailed request. No doubt Danny Hill and others will write to me, and I've got the highest regard for that union and for members of that union. They do an amazing job. I've had the great privilege of getting to know and meet many of them over my time in public life. We'll look at that carefully. We're all about trying to make sure that we keep our emergency services safe and our emergency services well, and particularly our big health team that are doing amazing work. And we often talk about nurses and doctors, and we should never forget though, and they wouldn't have a problem with me saying, we should never forget the ambulance paramedics who are transporting patients, responding to their normal caseload. On any given day, there are many hundreds of time-critical call-outs that aren't related to the pandemic. That work doesn't stop. You've got to keep doing that. So they do an amazing job. As I said, I haven't seen that detailed request, but I'm more than happy to look at it.
The AMA raised concerns in April about infection control at hotel quarantine. They wrote to the health department. They never received a response. Is that acceptable?
Well, I'm not. Again, I'm not finding fault with what the AMA say they've done. That may well have happened. I've got no reason to think that it didn't, but I've not seen that email, and I'm more than happy to try and follow that up. But I think that the appropriate mechanism to follow that up and any other matters like it is in fact the process that's kicked off today.
And one of their other concerns was reports that people from hotel quarantine had gone to hospital, were positive, but then allowed to catch Ubers and taxis back to hotels.
So I haven't seen the email, and again, I'm not quarrelling with whether it was sent or not. That's not really a matter for me. I can't really judge that, but I'm sure that those matters will be exactly the sort of things that as I said, the process that's kicked off today in earnest will definitely look at. It's exactly what it's set up to do. Sure.
You touched on the fact that the private security guard arrangement there may be a long-standing one, but the local residents seem to have
Yeah, I'm not certain of the exact terms of engagement. The point I think for the purposes of clarity, I think the point I was trying to make was that may well be a long-standing arrangement. I'm not certain. Again, I'm more than happy to check that out. But I would hope that, as challenging as this is for residents of this supported residential service, as challenging as it is for neighbours, people in that local community, I would hope there was some sense of reassurance that 10 have been relocated yesterday, 12 more today, and that ambulance paramedics, authorised officers, some security, and I'll get you some further details on that, and as I'm briefed, members of Victoria Police are there as well. This is a serious issue, it's being taken seriously, and I thank the whole team who are working really hard to try and make sure that we protect public health but also provide the most appropriate environment for these residents, many of whom have very, very complex needs, indeed. Sorry?
We've got a report about...
Candice, did you have a follow-up?
Thanks.
And then we'll go to Noel.
There's a video going around this morning which you may not have had a chance to see yet. It's of a police officer being flung through the air from a moving vehicle. He was trying to stop a lockdown breach. We understand. It's a disturbing video. He's okay, allegedly. But what's your take? I know without seeing the video.
Yeah, I've not seen the video, Candice, but I've tried to make the comment a few times, and I'll make it again. Victoria Police are out there in numbers, and they're doing some of the most important work. They really are. They are there keeping us safe. These rules, if they're not followed, that'll just mean numbers don't go down, and we keep having days like this where we've got many, many people who are dying. So it's very important work, and people should respect the police. They should do as the police ask them, and they should follow the rules. That's a pretty simple thing. This has been a very, very difficult year for Victoria Police, not just members but families, partners, kids of Victoria Police members. It's been a very challenging year, and they just keep turning up every hour of every shift, and they do us proud. And whether it's responding to family violence issues, whether it's enforcing these COVID-19 rules, or whether it's dealing with all the other work they have to do to fight crime and keep the community safe, you know, we are all so indebted to Victoria Police. And we've seen some behaviour toward Victoria Police in recent times that's been nothing short of shameful. Nothing short of shameful. Please, do as you're asked to do by Victoria Police. You're not asked for the fun of it, you're asked to keep you safe and every Victorian safe. That's why any those really bad choices, they don't just hurt those who are directly involved, they potentially hurt all of us.
Can I also ask, obviously with figures coming down and the suggestion last week we may have hit the peak, which is good for Victorians to hear, but we also have to brace ourselves for the fact that while the figures will be coming down, hopefully there will still be a continuing death toll. And have you been told?
No, I don't have. If your question is, do we have, or do I have modelling that shows? No, I don't have that. I think there are some projections that you can make, but I wouldn't get into that debate. What I would simply say is that for so long as we have large numbers of people in hospital that are gravely ill, then we will continue to see people who sadly they will die because of this COVID-19. That just means that all of us, and we have seen an age range, yes, it's concentrated amongst some older people, many of whom may have had a pre-existing condition, but there are otherwise healthy people who are younger who have died, and that is certainly a feature of the way this pandemic has presented across the world, where despite their best efforts in lots of different countries, they haven't been able to bring that sense of stability that stage 3 gave us, or the decline in numbers that stage 4 is giving us now. So the alternative to these rules is that it just runs wild, and you see some terribly, terribly tragic numbers that are much, much larger than these. Not to diminish this for those families involved, but it's in another league. And it is, if you are young, if you are otherwise healthy, then you are not immune from this. You simply aren't. So we will see, and the Chief Health Officer has gone to this a number of times, we will see further tragedy, because we will continue to see people that are in hospital But the only way to drive those numbers down, the only way to see more people through this, is for all of us to acknowledge that it's a long haul, and we've all just got to stick at this and find it in ourselves to make the best choices and to follow these rules, drive down movement, drive down case numbers, and then get to the other side of this. Then, in many respects, the really hard work will begin, because we've got a big job of repair to do. And I think Victorians are equal to that. We will continue, as we have, we'll work very hard, all of us, to make sure that these months and years ahead are all about jobs, skills, strength, and getting Victoria back on its feet.
Speaking of long hauls, you've stood up here for close to 50 days straight without taking a day
Thanks for
off.
reminding me of that, Rachel.
You do have colleagues, you've got a deputy. Do you, and we had doctors last week suggesting that if they had colleagues who'd worked that hard, they'd be concerned about public safety. Do you not trust your
I hadn't quite
colleagues
seen
to
those
take
reports. I thought they were
I
much.
think Stephen Parnas said something similar to that.
I've known Stephen for a long time. That's very kind of him.
Do you not trust your colleagues to step into the breach
I wouldn't
for you
read.
to take a day off?
Rachel, I don't know that you believe that. I don't know that that's really, like, we are all working very hard. This is one part of the work that's done, but there are many different roles that ministers play, and sometimes it's standing at a podium like this, and other times it's doing lots of other work. So, again, this is not about me. I'll be really clear with you. I won't ask people to work harder than I do. I never have, and I never will. And I'll be here until this is done, because that's an important part of the job that I have. And I hope that I answer questions as frankly and as honestly and as politely as I can. But whilst Stephen Parnas and others have made those comments, that's fine. They're entitled to those views. But I wouldn't want anyone to think that me being here was a function of anything other than me being accountable for the job that I have. We've got a great team. I think you know and understand that they're all working very hard. They might be doing different things than standing here for an hour and a half every day, but there are lots of other functions to these roles than just standing here. As critically important as standing here is, Rachel.
Apparently there's no requirement to notify your body corporate if you test positive to coronavirus, and some residents we've spoken to, particularly in those high-rise towers, are concerned about that given the shared facilities, lifts,
Sure.
things like that. Does that need to change? Should people be required to notify the body corporate if they are positive?
Well, I think what needs to happen first of all is I need to follow that up for you, and I'll speak to the Chief Health Officer about that. And if there's if that's presenting as an issue, and again, I'm in no way downplaying any anxiety that residents might be feeling, but there can be a perception, there can be a sense of anxiety, whether that's real, and I'm not diminishing that, but whether it's in fact a real risk to public health, that's something I might have to get some advice on.
And apparently there's still a few websites where you're able to book short stay accommodation in some of those, I guess, particularly city high-rise
I have
towers.
seen that, and I think we're well and truly onto that issue.
What are you doing to...
Well, there's no reason to be having any short stay. You should be at home now. There might be some very, very narrow reasons, very narrow, but I think that's something that Consumer Affairs Victoria are looking at, but I can try and get you an update on that. Again, I'm not briefed on it.
I asked you last week about the local council elections. You said there
Yes.
was discussions ongoing. Has that developed at all? Are those elections going to go ahead in October?
There's been no decision made, as best I can recall, but as soon as we have made a decision one way or the other, then I'm more than happy to make that a feature of one of our briefings.
You personally think, given difficult to campaign, given the
Yeah, well, well, I think any campaign in the midst of a global pandemic, no matter when it's on, will always have impacts. It'll look different. It'll be different. But I think that this stage 4 lockdown, this second wave, does present, I think, a wholly unique challenge to getting out and talking to people and mounting your case, whether it be in the centre of Melbourne or in other local government areas. But that's why we're talking about it. We're having a think about it. But I'm not aware of that having been finalised. But if and when it is, then of course we'll talk to you about it.
So, Premier, just back to Hamilton House.
Yes.
Our reporter down there says There are no ambulances right now, no ambulance officers. There is a police presence, but it only arrived after this morning, after a resident had gone down to the local IGA and bought something and returned. So that's, are you therefore surprised at the level of community concern when that's what's going on there?
Well, I don't know whether that person is again, I'd always be careful not to comment on an individual case, but I'm not certain about the virus status of that person. I'm not sure about exactly what's happened with that person and where they've gone, what they've done. Obviously, ambulances are not there permanently. They'll be there for the purposes of transporting people, so they'll come and go, and that's where I would assume 22 of those residents who are either out or are in the process of being transported out today, they'll be by ambulance in the main, and on that basis the ambulances won't be there as a kind of static thing. Again, this is a private SRS. I think everyone's doing everything they can to support the residents and therefore the local community from a public health point of view. I've given you all the details I've got literally as of an hour ago, or an hour and a half ago probably, but I'm more than happy to come back if there's further things, and if you've got some reports, by all means speak to Steph and we'll chase it up.
Are we on top of the contact tracing issues now, given the number of active cases is coming down?
Well, we do, Lundy, look, whenever you've got these sort of volumes, it's always going to be challenging, and I think there's been an acknowledgement of that from lots of different quarters. Brett has made the point many times, I've not made it, but on his behalf I'll make it again. There are plenty of countries in the world that stopped contact tracing once they got beyond 50 cases per day. We've not done that. It's a massive team, they're all working hard. We get to national dashboard. Again, I haven't looked at today's numbers, but my last look at it, we make contact with all cases within 24 hours of us being notified. The time between the person being notified by the lab and us being notified is around 2 hours. It can vary a little bit, but it's in that kind of window. So that means we're making contact with everybody within, say, 26 hours of them being told that they have got this. Then there is interviews that are done progressively throughout that period. There'll always be and I'm pleased to say, a falling number of people, a decreasing number of people that we can't make contact with for whatever reason. And that's where the door knocking that's going on, literally thousands and thousands of doors being knocked on just as we speak now, cases as well as close contacts. That's what really opens it all up, because it's only after that interview's done that you can then with confidence reach out to close contacts and start the process of text, phone call, all of that work. So we're delivering against those nationally agreed benchmarks. I won't say that there isn't some pressure there. Of course there is with the sheer volume, but it's a big team and they're working very, very hard.
And do you know how many you've got on that team now?
My last update, which would be as of Friday, I think we're up to about 2,600 people. They don't all necessarily work at exactly the same time, but it's a big team. There's shifts, there's outbreak teams, there are people doing interviews, there are people doing data management, there are people doing door knocking and the coordination of that door knocking. There's then teams of people who do teaming and tasking, so every day's demand is slightly different, so you reorganise and reallocate resources as best you can to meet the challenge you face that day or that week. It's a big team. It's from both Commonwealth, state, other states, and indeed the private sector. And I think they're doing a great job in very, very challenging circumstances. The most impressive thing, I have a meeting, I think it's sort of 3 times a week. We sit down with the public health team and go through things, and a lot of this nuts and bolts stuff is what we talk about. The really impressive thing about them is not only is it a massive team with a massive task, but they're also, every day they're looking for ways to improve. How do we find a few minutes here, a few minutes there, maybe an hour? How do we get to more people faster? And that's a pretty impressive thing, to be improving your performance while your task is getting much bigger every week, every month. That's something that they should be very proud of, and I'm certainly proud of them.
Have you got any of the latest figures or trends on the number of people who aren't home, who should be? Because obviously originally it was quite staggering.
It was very high. I think it has probably come down. We're seeing more and more people. What I'm planning to do, two important things for this week, a list I'm certain to add to. In the first instance, we've got a big piece of work around hospital-based infections, health worker infections. some of which will be hospital-based, some of which will be people getting the virus, you know, family, friends, out in the community, staff to staff transmission. So that's probably first half of the week. Hopefully tomorrow, if it can be tomorrow, it will be. I understood that there was going to be, I'd left this to others to arrange a course, but Victoria Police, I think we're going to take you through in perhaps a separate process, just because it might take some time, all the different compliance. So it'd be everything from some of the questions that Candice was asking before, curfew, all the different fines, and that would involve that kind of doubling back around the number of referrals that have been sent to Victoria Police and the action that they had taken. I'll aim to give you a door knocking update tomorrow, which will be, it's kind of a proxy for that, if you like. That'll give you the number that have been referred on. I think that number's coming down. And that'll be the function of two things. I think, one, more and more people are doing the right thing. Secondly, I think the quality of our data gets better every single day. So you'll have some people, for instance, who will have gone and isolated somewhere else. The address we believe they should be found at isn't in fact the address. Then there's also the obvious issue of not everybody will come to the door. So they might have been there, but they didn't come to the door. But our last number that I reported here was the then biggest day, which was 1,150 doors had been knocked on, and all but 150 were home and were able to be spoken to, not just for checking purposes, but for help, assistance, clarity, just to make sure that everyone's getting what they need. And those authorised officers from the health department, together with a very significant number of ADF, they're doing an absolutely fantastic job. Not just checking up on people, as important as that is, but also making sure if they've got an urgent need for something. A lot of people don't have the support networks that perhaps we do. You know, in this room, I think most of us, if we needed some groceries, we could probably reach out to someone. If we needed a script filled, we could probably reach out to someone. There's a lot of people in the community that don't have that. So the door knock serves both those purposes. Are you there? Are you supposed to, we're supposed to be, and also, is there anything that we can get you? Anything we can do for you? Let's aim for an update quite soon on that. I don't have data today, but if I can make that a feature of tomorrow or Wednesday, I will.
Have you heard from the hotel quarantine inquiry as to whether you personally will be called, or your office, if they notify?
If I'm called, I'll be there. I have not been, but if I were called, I'll be there.
Just another question, please.
Yes.
Has the public health team got a sense or an idea of how many of our positive cases are asymptomatic?
I would need to get them to come back to you. I'm happy to try and confirm, if not in the show release later today, then it can be done offline. It'll be a fairly small number that had no symptoms at all and yet were prompted to get tested. And I think that's kind of a global trend. There are, the vast majority of people are coming forward, well, it's almost exclusive, except for the ones where it's not a general thing. We'll go and engage with a given workforce. We'll go and talk to people about asymptomatic testing, or indeed pre-symptomatic testing. But those who are turning up, apart from that smaller number, which is much more about workforces and outbreaks and close contact testing, all of which are done separately. That's not messaging from this podium. That's very much a personal thing that's done by in the main our outbreak management teams. The rest of the testing is all people with symptoms. Now, albeit the symptoms can be very, very mild, and that's the point that was made yesterday, and I will take the opportunity to make it again. If you begin to feel sick, so headache, scratchy throat, fever, runny nose, cough, all of those sorts of symptoms, at the very beginning of those symptoms, you've got to come forward and get tested. Continuing, to go to work, for instance, for 2 or 3 days, and then when your symptoms potentially get worse, then you say, oh, right, I better go and get tested. The height of your infectivity can be in those very early stages, and even indeed before that. Now, we can't blame people for, prior to getting symptoms, but if you're a close contact, then you need to get tested. Like if you think you might have come into contact with the same household, for instance. If you've got even the mildest symptoms, come forward, get tested. and please stay at home until you get the results. And as the example, it's only one example, I know, but the labs are working very hard to try and turn those tests around as fast as they possibly can. Any other issues? If not, thank you all very much, and we will see you tomorrow.
Noel had a good day yesterday?
Huh?
Noel had a good day
He
yesterday?
did. We had nice lunch. Yeah, it was good.
It'd be strange having your 18 for